This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
It is good to be back with you live in the studio for our version of Health Watch every Sunday, 8 till 9 on Talk Radio 1210 WPHT. And as always, we will discuss the who, what, when, where, why, and how of Innovative Medical Associates with Dr. Molly Fantasia. But before we get into the show today, Dr. Molly and I wanted to send a shout out to the family of Sid Mark. As you probably know by now, Sid passed away at the ripe young age of 88 the other day. And remember, Dr. Molly, when we first started the show, they said to us, well, listen, you're going to be on before Sid.
That's right.
And we were like, oh, yeah, that's great.
Cool.
And we came in the studio. When we first did the show, we came in the studio.
That's
and
right.
Sid would always talk to us. And you'd ask him a question about Sinatra, and he goes on for 10 minutes about, well, this is because of that, and that's because of this. So it was really nice to have met him. And our show started at 8, his started at 9, but he was in the studio at 7.
Oh, yeah. He was there when we got there.
Exactly.
Man.
He was there when we got there and going over his
God
music.
Bless
But
him.
there will never be another Sid.
The old guard, John.
That's right. So we do send a shout-out to his family, our sympathies. And listen, the legend will live on.
Oh, man.
Here on Talk Radio 1210 WPHT. And again, it is Health Watch, Sundays 8 till 9. Dr. Molly Fantasia is here, and as I said before, we talk about the who, what, when, where, why, and how of Innovative Medical Associates. And if at any time during the course of the show you have a medical challenge you want to discuss with Dr. Molly, our number here in the studio is 855-839-1210. That's 855-839-1210. Let's get started, Dr. Molly, with Innovative Medical Associates does what?
That's a loaded question.
Exactly, yeah.
Hey, John, well, Innovative Medical Associates is a cooperative between the healthcare providers and myself. I own the facility. And so what happens is that we believe in anything a primary care facility can do, we can do it. You come in, you need blood pressure med, we can let you leave with blood pressure med. You come in, you have a sore throat, we can take care of the sore throat. But fundamentally, it's the philosophy of what we do that changes. And the philosophy says, let's use the least amount of pharmaceutical possible to correct the medical challenge. And along with that, let's bring in some natural substances to help move it along, and so the patient doesn't suffer the side effects of the pharmaceuticals as well as his condition.
And with every consultation, pretty much you hear people asking you about Neutraceuticals. Well, I can go to the health food store.
Oh, yeah, sure. You can. The question is, are you getting the right, and are you getting the right delivery from the health food store? So the question is, you need some guidance in that regard, and I believe we do a good job with that.
What's the difference between what you do and what you can get in the health food store?
Well, one of the things is the purity of the product is fabulous. And the second thing is the delivery system, of course. We use hydration as a vehicle to deliver these products, whether they are amino acids, vitamins, minerals, these things you'd find in the health food store. And we're able to make them appropriate for the patient as well as the condition.
And when you give someone the hydration protocols, it's specific to what their condition is, correct?
And the patient. We have to check and make sure that they can take the fluid. There's a whole bunch of checklists, even though it doesn't look it. It's going on in the background, And what we want to do, and of course, since we are an actual primary care facility, we can run the bloods right there, send them out to LabCorp, Quest. We can do everything you would normally do, like let's say in an urgent care. Only I think we do it better, quicker, and actually with the patient fully functional coming into the clinic. We want to make sure that they leave the same way and that they're happy.
And better results.
That's what I was saying, yes.
That's
absolutely,
really what the bottom line
without a question.
And a lot of people say, well, Dr. Molly, I'm sitting there, and the guy across from me has an orange bag, and I have a yellow
Oh,
bag.
yeah.
And
Don't judge a book by its cover.
So,
right.
The color doesn't matter, right?
The color doesn't matter. What matters is the constituents, and what is it that we're looking to effectuate the change. I mean, if you have high blood pressure, there are many types of nutraceuticals that can do so. I want to make it clear, we are not a spa. You don't come in for your hangover remedy. You don't come in if you just want to come in for feeling less fatigued. I want to know why you have the fatigue. I want to know what's going on biochemically. So it's not enough to just come in and say, hey, I would like to have 2 bags of bees. Nah, it doesn't work like that.
You are a medical facility.
That's
right.
That's
really what the difference
right.
is.
That is
as
exactly.
opposed to someone saying, "Well, we're a spa, and
right.
You can get a facelift too while you're getting."
Well, yeah, Well, actually, we can't give you a facelift,
right.
but we sure can give you a facial.
Right, exactly.
But again, we're using what? Organic, naturally sourced product.
You mentioned the least amount of pharmaceuticals,
sure.
and I'm assuming, so confirm this, that it's because of side effects of pharmaceuticals.
Absolutely. Look around. Just pick up any drug from the drugstore today and look at the packet that goes in there that says, hey, if you take this, you're going to lose your libido, you're going to have a problem with your mouth. And guess what? You might die. So it's like...
It's not a pamphlet, it's a booklet.
That's
now.
right.
Right?
That's
it's
right.
More like that.
And every day there are newer drugs coming out. And when you think about it, John, it takes a long time, allegedly, to get drug approval, right?
Right.
But you saw how quick we put out, vaccines.
That's right.
And guess what? We put out drugs for, let's say, the lipids pretty quickly as well, all these new injectables. So, people are not dumb. You get that pamphlet, as you say, or booklet. It isn't healthy. I just had a conversation with a guy today, this morning, actually, coming down the elevator. Oh, I'm on that new injectable for my lipids. I said, really? I said, he goes, but I'm not feeling quite right. I said, really? He said, I have shaking. I said, how long you been on it? Oh, just about 4 weeks. I said, well, God bless you. You ought to be in my chair because there's a lot of side effects with those new drugs.
That's the one I was on once.
Whoa. I told you, get off.
You said you're not going to like it. I didn't. I got off it, and I got another med.
Yeah, there are others today.
Yeah. What about side effects for nutraceuticals?
Of course, there can be some side effects. Listen, if you come in, you'll read a whole litany of side effects from IV therapies because unfortunately, New Jersey requires that it wouldn't matter whether you're getting chemotherapy or you're getting, vitamin C drip. But frankly, I have never had any side effects with the nutraceutical powders that we use because I'm very fussy about the powders. And if anything, I would say maybe a little fluctuation in the blood sugar, which is why we keep snacks on the counter.
And the powders are that's what you get.
That's
and then
our base. Yes,
that's your base, and you mix
of course,
that.
Injectables. Yes.
Yeah, and the protocols are your protocols
Absolutely.
that you developed.
Absolutely.
So it's a formula that
right. And
I
have two compounding pharmacists that I use exclusively.
And that's what you get when you get the hydration.
Absolutely.
And how long can a person expect? Because I know. The other day, one of your patients said to me, "How long have you been coming?" I said, "Well, 20 years." He said,
we hear
that. I got 19. He says, "You got me beat by 1." So,
listen, I don't look. You're not chained to me.
That's right.
We don't chain you, but you'll find that you do pretty well. In fact, one of my patients who is a physician stopped me yesterday. He goes, "I'm sort of feeling a little badly." He said, "I'm on number 9 next week, and my 10th will be up. What am I going to do? Because I think I need this." I said, "Well, if you think you need it, Doc, we're going to arrange. But I want to do the blood work as well so we can hone in on specific areas."
So you can come in and initially it's
right,
10 to 15 treatments?
Right. Usually we can effectuate change usually in as little as 5 to 15 weeks.
Okay, we are coming up on our first break of the morning. Our show is called Health Watch. You'll find us here every Sunday from 8 till 9, the live version here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. And our number here, if you have a question for Dr. Molly, you have a medical challenge you want to run by her, 855-839-1210 is the number, 855-839-1210 with Dr. Molly Fantasia. I'm your host, John DeMasi. We return. More of today's Health Watch after these words. And we're back here on Health Watch. Operators, as always, are standing by at Innovative Medical Associates. You can contact them right now at 856-489-0505. 856-489-0505. You have questions, you want to sit down and make that appointment to sit down with Dr. Molly. The initial consultation is complimentary, and that's where you really find out a lot of the information that you'll need. 856-489-0505. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And our show is called Health Watch. You'll find us here every Sunday, the live version, 8 till 9. You're on Talk Radio 1210 WPHT. Again, our number here in the studio is 855-839-1210. We often talk, Dr. Molly, on the show about nutraceuticals. And I know you wanted to focus today on nutraceuticals for cancer support, which is a big part of your practice.
Oh, my goodness, yeah. We have plenty of patients who do the conventional treatment, and we're using supportive treatment. We have plenty of patients who don't want anything to do with conventional treatment, and we then support them in their quest. And the other thing is we have patients who've completed conventional treatment and unfortunately have a second bout and they don't want to go through it again. So I've spent a lot of time this week, I would say, on cancer supportive treatment. And one of the things I think you and I always dwell on is, of course, our friend vitamin C.
Yes.
And many people think that's all we do. Well, no. We found that in certain cancers across the board, there are many other extracts that can help people, and they work on different types of cancer, and they work in our bodies in a certain way. For example, just this week I read 2 articles on lower dose vitamin D and its relationship to colon cancer and breast cancer. So, of course, we have injectable vitamin D, and we have it in a way that we believe is better for the patient because it's depot. And I'm surprised. I went through my files to see when the baseline is when my breast cancer patients come in. Invariably, they do have low vitamin D. So, of course, vitamin D is part of our protocol. Do you want to say something, John?
No. I was just curious because I know you have a list of nutraceuticals that you use, and some of them are off-label. I know you'll get to that.
Oh, yeah.
So, but I was just curious as to that. I want to hear about the list.
Oh, okay. All right. So the other thing that we use is a mushroom extract, and people don't realize that mushrooms are very, very important. They're immune modulators. They are anti-tumor effect on mushrooms. Who'd ever believe that? So mushroom extracts. Now, people hear about turkey tail, but there are many others. And if you think about it, some of the extracts that I use in the IVs, like sometimes beta-glucan, can be extracted from mushrooms as well as from lecithin. So there are many, many extracts that we use. And again, it's going to depend on the patient. Obviously, I'm not going to try to give a patient who has an allergy to mushrooms.
Of
right?
course
Even in
not.
the powder form, even in the clear form. But I am going to give them a beta-glucan that we might extract from another source. So there's a lot of thought that goes into this. The other thing we see is many people come into us with low levels of coenzyme Q10. Now, in many clinics that do what we do, coenzyme Q10 is a part of their cardiac protocols, not necessarily their cancer protocols. And why is that? Because when they're taking statins, they reduce the coenzyme Q10, and everybody's seen all the handsome doctors on TV talking about the brand of CoQ10 that they give out. Well, we actually have injectable CoQ10, all right? So lower levels of CoQ10 are very, very important, and many times in most cancer patients, we see that. How's about we look at green tea extract? And why? It slows the growth of new blood vessels that feed the tumor. So and again, I want to talk about this. What do I look at? It isn't necessarily the green tea. It's extracts from the green tea that I'm looking at, constituents. Same thing with fish oil. Now, again, this is another one, John, fish oil. Everybody says, oh, fish oil's for cardiac, right? Right? No. EPA decreases the expression of key receptors in the endothelial cells, which decrease inflammation. And inflammation is something we have to go after, whether it's in cardiac or cancer. Okay, so there's some other things we use. Don't forget frankincense, one of my favorites. Also, what? It is an anti-inflammatory. So again, inflammatory conditions can be good, but they also can be very deadly.
You know, listening to you, there's a lot that goes into what you do, and I think people sometimes take it kind of for granted that, well, yeah, you do the hydration and you have the protocols, but I mean, you're always reading, you're always researching, you're always looking, and here you've just given us like a few
of them.
But I know there's more.
Listen, if you come in and you go into our quote-unquote room where the injectables are, every week you see a rotation. Every week. And it's getting harder and harder, as you know, because we have FDA problems, we have distributor problems, all of those things. I try to hold the line on cost for my patients, but I won't compromise on quality. I will not. All right, so frankincense is one, and there's another thing. There was huge data on frankincense and its effect on pancreatic cancer, which we all know has been pretty deadly. And interesting, they've used frankincense in certain alternative settings, and we have too. In particular, when the patient has gone in to have an ablation on the pancreas, a cryoablation, which means they freeze the tumor. We then hope that they get the conventional thing done, come back to us, and we'll feed your body with the right nutraceutical to help hold that particular challenge and hold your challenge at bay. Melatonin. Everybody thinks that's just for sleep, right?
That's what I thought.
Everybody does. Melatonin, very important. There are many trials showing that they have an impact on many of our body's natural killer cells. So melatonin is highly antioxidant. So it's as antioxidant as vitamin C. It may be even more.
How about that?
Yeah, people don't know. Now, we can deliver melatonin in an injectable form. But of course, I have to be careful because I don't want you driving home and falling asleep.
Exactly.
So there are some pragmatic things that have to be done. Then you have to look at enzymatics, pancreatic enzymes. So we deliver orally, and we have a list. As well, I have the best partner in crime as far as coming up with the nutraceuticals that we have to take orally. You know that, Joe.
Yes,
but
of course.
our pancreatic enzymes, and again, you'll notice we don't have a lot of brands in-house. We will tell you which ones to get, which ones are the best or the second best, because we're interested in people utilizing what they need orally, but minimizing how much cost they have to do with the oral so that they can concentrate on getting the appropriate IV amount of the nutraceutical for their particular challenge.
Do you recommend, for example, if you come in and you get the hydration weekly, as I do you recommend that you also supplement that with
sometimes, of course,
things you'd get in the health food store?
Of course, but we want to be particular about the brands we use because we don't want any junk in there that we have to chelate out after. So we're very particular. There's a reason why when we recommend, we're recommending certain quality products, and that's because we're looking at the data behind them.
And you've often done that for me. And your
sure.
nurse Barbara has said,
she's
look,
the best.
You go here and you go there, and then you get this from there and you get that from there. It's like she gives you the list.
Yeah, but we're not sending you all over the world to get this.
Right.
We send you to one place or we tell you to order something off the web.
Right, exactly.
But, it's interesting because a lot of clinics that do what we do make a ton of money on their oral supplements. Let's not lose track of that.
They sell their own brand, which
right,
is not
right.
their
Usually,
own brand.
Usually it's not their own brand,
Right.
but nonetheless, and I'm not saying that for all of them. I'm saying, we have to be judicious on what we put into our bodies as well as what we take in IV. The other thing we're big on is pro and prebiotics because they help support the immune system. And by supporting your own immune system, we can then lessen some of the toxic effects of some of the chemotherapy, some of the radiation, and some of the conventional immunotherapies that are being done. But again, you want to use a good product. So these are some of the things. Selenium, it actually starts to activate your killer cells. We obviously use that. Milk thistle extract, okay? Licorice extract, curcumin. I mean, my list can go on and on and on. But the point is, there are many types of help out there of God's ingredients, many types.
And you've often said on this show that just don't walk into the health food store. Have someone give you some
good advice,
some guidance, some good advice,
right,
which is what you do, because invariably people come in and tell you, well, Dr. Molly, I went into the health food store. They come in with the bags, and the bags have 20 things in it, of which 10 do the same thing.
Right. And then how about the other 10 that are diametrically opposed to the things you really
right,
need?
Exactly.
And this, my friends, is a big problem. And I would say that we try to minimize that for our patients by giving them a list of things that they may need. But what do we start with, John? We start with hydration, and we start with you bringing in all your own vitamins. We want to see what you've been taking up to this point, because why do natural substances fail? There's a reason. They fail because you can't get an appropriate dose. You're not mixing the appropriate number of nutraceuticals together. You're diametrically opposing what you want to do, and you may be making yourself worse.
Exactly. We are coming up on our halfway point of the show, which means you have plenty of time to call in with a question or a comment or a medical challenge that you want to run by Dr. Molly. 855-839-1210 is our number here in the studio, 855-839-1210. It's Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPH.D. Dr. Molly Fantasia is here, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey, and I'm John DeMasi. We're both returning. More Health Watch after these words. Operator standing by right now at Innovative Medical Associates. If you have a question, you're a little bashful, you don't want to come on the radio and talk to Dr. Molly, well, you can talk to the operators at 856-489-0505, 856-489-0505. You call and make your appointment to sit down with Dr. Molly. The initial consultation is complimentary. You'll find out a lot of information on that, and then you can make your decision as to whether you want to move forward or not. Pretty simple process. 856-489-0505. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And if you've just tuned in, our program is called Health Watch. You'll find us here every Sunday, the live version 8 till 9. You're on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. And our number here in the studio, 855-839-1210. I know you always like to talk about patients, Dr. Molly.
I do.
And you kind of go through what has happened and what you're doing. Your patient, Dale,
yes,
this is a really good case.
This is a case that was heartbreaking for me. Young man, self-employed, very smart boy. He's a carpenter, self-employed carpenter. I think he has 4 kids. His wife and he came in pretty dejected. They were referred to me from another physician. And, the other physicians put their hands up and said there's nothing else they can do. It's a head and neck cancer. He had a large lump on the right side of his throat that was bulging out. And also, he had a growth on his tongue that was the size of a large mushroom.
Wow.
Okay?
Wow.
Now, this thing really knocked me for a loop, not along my docs. Okay. And what happened is he said, I really think I need to be here because Dr. So-and-so said you could help me. And no one else can. I went to 4 conventional physicians, and all they wanted to do was radiate and do chemotherapy. So Dr. Molly asked the famous question, why can't you have surgery? Oh, it can't be done because the growth on my side is too large and it can't be done. I said, really? I said, let me look around for a surgeon who might be able to do this. In the meantime, get in my chair. So let's give you an update. 5 weeks later, the growth on his throat and neck, I guess that's the right way to say it, neck, it has greatly reduced. In the meantime, I'm keeping a watch on what's going on in the tongue, but I managed to get him an appointment with the top-notch surgeon who does nothing but head and neck surgery, tongue, head, and neck. And actually another patient of mine went to him and had tremendous results. He's in the chair as well at the same time. We get this young man over there, and he said, oh, yes, I can do this surgery, and I think I can get 90% of this out of the way. And he said, by the way, the nodule on your thing is a lot smaller than what the report from your initial consultation said. He said, oh, yeah, I'm over at Dr. Molly's. The guy goes, well, I don't know about Dr. Molly's, but it's smaller. We can get in and do that as well as the tongue. So guess what? This is a win for me.
Absolutely. Now, you're going to keep us posted.
Oh, my gosh, yes.
He's getting the surgery soon, right?
Well, we have him scheduled for the tattooing, which is what they have to do first, by, I think, March 7th, and then he'd be going right in for the surgery. The question is, I'm hoping that his insurance will help pay for that, because they didn't want to pay for the view for the doc to do it. So anyway, to do the initial consult. But the point is, I try to act as a patient advocate too, because in a case like this, to tell a young man to go home with this, no good's going to come out of having that tumor in there, right? No. I mean, you heard me say this. When you have cancer, and if you have the option to get it out, what do I tell everybody?
Get it out.
Get it out, because it can help us buy time for the Neutraceuticals and some of the subclinical doses of traditional stuff to work, and also buy time for me to get you over to an oncologist that will work with me and help you. So, I mean, these are some of the things I do. In addition to that, this week, I've had several cancer patients who are doing extremely well, and I'm thrilled about it. I have another one, Vita. God bless her. Her son-in-law brings her in. He's in Cape May working. He drives her to me twice a week because I asked him to bring her in. And her blood work came over this week from the traditional oncologist, where she is actually getting an immunotherapy right now. And we didn't do any therapy. We only did it once this week because we didn't want to interfere with the traditional therapy. Came in and the blood work looked pretty darn good. And she's up there in age, I have to tell you.
You told me this week that you spent more time than ever on patient advocacy.
I did. I did. Because I wanted to get my patients into the right places to make sure that if the surgery needs to be done, let's get it done. If, the insurance doesn't want to pay for stuff, you get tied up on some of that because you want to make sure that all our records are up to date and the doctor has signed off on everything from our perspective so that the surgeon has everything he needs. Look, it's just part of the job. I want to do the best I can for each and every patient. And it doesn't matter. Cancer is only one area of what we do. How about our autoimmune? How about what we're doing with the MSCs? The growth factors, et cetera, that we're using. Our boy Jeremy, he came in for his follow-up. As you know, we gave him injections. He came in for his follow-up. He goes, look at this knee. He's not having pain. His knee is not swollen. Dr. Carol, who's our physical therapist, took a look at it this week. Dr. Pat took a look at it, who actually did the injections. And I've got to tell you, we're totally optimistic that that tear is going to be helped with the procedure.
Talk about your patient with chronic fatigue.
Oh, that's Dr. Carol, actually. So Carol came in. She had post-COVID, and she's one of our physical therapists. And so she shows me all the blood work that the traditionalist did. And I said, geez, she goes, look, I don't have chronic fatigue. My CMV is perfect. I said, really? I said, Carol, why are you having this particular, but why can't I shake this fatigue? She said, I know what to do. She's working herself out. She does everything correctly. So I decided to do a different type of immunopanel. and I did it. She turned out to have an obscure herpes virus, a herpes 6, number 6. That's not usually tested for, but I have a panel that does look for these kinds of obscure things, especially if people aren't doing well and everything is negative, and the doctor's telling them now it's in your head, which I don't believe. Bottom line was she did test positive for this. And what's interesting, I put this together because she works also at a facility where she treats babies, young babies who need stretching and this kind of thing. Well, generally herpes 6 is something that is generally in children, and it usually gives them roseola. It doesn't usually affect adults, but it can, particularly if their immune system is compromised. And what did she have? She had COVID. She was in post-COVID state. So putting it together, we now treated her with natural antivirals, and I'm glad to say that she's back to work as well, and she's doing well. So there's a success story.
And all because you did a different kind of a test,
right? Did a different
most
approach.
People wouldn't have done.
Well, the bottom line is, I didn't understand why she wasn't getting better on a traditional autoimmune post-COVID type of protocol, and I realized afterwards, and I said, "There's something else going on, and we need to look at it." And so I just ran a particular autoimmune panel sort of to put together the sleuthing, and this is what we got. So that's another success story, and why I say we think out of the box, John.
Sometimes you remind me of a detective.
I do. Yeah. I like to call myself a medical archaeologist because I like to look at all these facets and then put them together and see what was happening in the past that affected you as well as the present.
Talk real quickly. You mentioned the chronic fatigue patient, and you talked about Dale. Earlier, you were talking about the nutraceuticals for cancer.
All right.
Off-label use of certain drugs.
Oh, yes.
I mean, what do you mean by that?
I mean that there are certain drugs that have been around for years, and we can use them. One of the drugs that is out right now that's very popular for anti-inflammatory is something called Voltaren. Everybody knows about it, right? Well, the constituent in Voltaren is what I'm looking at, and actually it comes in an injectable, and it's being used in Italy, actually, for cancer patients, and a subclinical dose. So there's one of them. Something else that we use a lot of is that we use something called LDN, low-dose naltrexone. And everyone knows that naltrexone is an opiate antagonist. We use it, Narcan, to help these people, get revived. But it has other uses, and part of the uses is the fact that it does fill receptors, and we're finding it holds down inflammation for cancer, for autoimmune, and a ton of other things. I mean, people out there, I want you to realize LDN is actually a wonderful, wonderful drug. And I will tell you this, it's being used extensively for GI problems, and we were one of the first to use it because we actually called out to the people who were doing the research in this from Penn State. So LDN is something we use along with hydration protocols to sort of work synergistically with the LDN in terms of cancer support, immune support, and anti-inflammatory support.
And I understand you're going to be speaking at a symposium for LDN sometime in June?
Yes, up in somewhere near, I think, Scranton or somewhere up there. One of the universities. Yes. So yes, I'll tape maybe I'll tape the symposium and we'll play excerpts or something. I don't know.
That'll be good.
I'm sure there's going to be a lot of other people there that are smarter than I am, so it'll be fine.
Well, I don't know about that.
Well, it'll be fine. But I'm telling people that they need to look for LDN, and the way we make it, that makes a difference. Our patients tend to have better results quicker than a lot of other people.
All right, we're coming up on our final break of the morning, which means you still have time to jump in with a question or a medical challenge you want to run by Dr. Molly. 855-839-1210 is the number here, 855-839-1210. Our show is called Health Watch. You'll find us here every Sunday, 8 until 9, the live version here on Talk Radio 1210, WPHT. Again, the number here in the studio, 855-839-1210. With Dr. Molly Fantasia, I'm John DeMasi. We're coming back with more Health Watch after these words. Back here on Health Watch, operators standing by right now, and they'll be there well after we leave you at 9 o'clock. if you want to talk to them and schedule an appointment to sit down with Dr. Molly, the initial consultation is complimentary, as we've always told you. 856-489-0505. 856-489-0505. It's Innovative Medical Associates, Marlton, New Jersey, and also the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. Before we get back into the show, and we have a caller we're going to get to in a moment, I do want to remind you that 2 weeks from today is Mother's Day, believe it or not. And you may want to do a couple of things. Like you may want to go to the website, innovativemedicalassociates.com, and check out the complete line of skincare products developed by Dr. Molly Fantasia and well-known area dermatologist Dr. Harvey Glass. You can do that, or you can schedule a facial at Innovative Medical Associates. So that's a good Mother's Day gift, right? So do that. Check it out for yourself. InnovativeMedicalAssociates.com is the website. Health Watch is the show, Sundays 8 till 9, Talk Radio 1210, WPHT. Tom is in Pennsburg. Tom, good morning. You're on Health Watch with Dr. Molly.
Hi, Tom. How are you?
Good morning. My question is, how would you measure magnesium?
Well, are you asking this because you don't believe in the serum levels of magnesium, Tom? I think you've called me before and I enjoy talking to you, right? We generally use the traditional testing, and we have a matrix. There is a matrix to look at serum levels and what actually would be the intercellular levels, and there is a formulary for that. So how would you test for magnesium?
The red cell test, or
yes, that's why I knew. You're looking for the intercellular. I got that. The problem is, that can, I don't know who's doing that right now. We were trying to have that done at one point with two of the conventional labs, and I have a hard time with some of the labs that were doing this. I'm not sure that I particularly believed their results. So the methodology bothered me. So I understand, and it is a problem. I know that magnesium is extremely important for everything, including, by the way, I didn't mention magnesium in terms of the nutraceuticals for cancer, but it is one that we should look at. So, Tom, you always give me a nice question, and I appreciate it. So thank you. I sort of answered it indirectly. As I said, I know you didn't want me to say we measure the serum level, but frankly, I really can't justify using the test that you're talking about, looking at the red blood cells. But I appreciate the call.
Okay, Tom?
Thank you, and God bless you.
Tom, thank you. Thanks for the call.
Thank
Appreciate
you.
it. 855-839-1210
I want Tom
is
to
our
know
number.
that was a very good call, and I understand it. But again, John, I sort of am relegated by the fact that we are a licensed facility. So I have to be careful about what type of testing I do. I've really got to make sure that the methodology is CLIA methodology, meaning it's regulated. I just can't particularly use a particular lab if I don't appreciate the results. In other words, how they get to the results.
Exactly. So you're not only talking to a patient, but you're also studying the labs and what they do and how they do it.
I really, as you know, I have a limited number of outside labs other than the two biggest ones that we use which is LabCorp and Quest. Everybody knows them.
Right.
I can say it, LabCorp and Quest. And I will say that actually they've all been coming up with the molecular testing, but I knew he was looking at the red blood cells, and I think I sort of answered that indirectly.
Right.
I know you didn't want the serum level, but unfortunately, I have to look at the serum level and then do a little bit of a calculation how much, if it's in the serum, how much is truly in the cell. And again, it would just be a matter of using the formulary, but it's not totally precise. You could have a little less or a little more.
All right, we got a couple minutes left of the show. I know you wanted to talk about scleroderma.
Sure.
What is that? Explain.
Scleroderma is a rare, disabling, and sometimes fatal disease, and it's an autoimmune disease that we've seen. And I haven't seen too much of that in the last couple of years. I actually had a friend of mine who actually passed away from scleroderma. But what it does is the body swells, the skin starts to become dense. and very like leathery, and people look like soap people. That's what they used to call them, soapy skin. It was beautifully milky white. They also get calcium deposits, and it causes the joints to swell and that kind of thing. Movement, fatigue. You really have a lot of problems. Well, here's the thing. There's no known cure for scleroderma. Many times they're treated with the rheumatoid drugs like Humira, the stuff that they usually use for autoimmune. But again, they have so-so results. But there is a methodology that can be used for scleroderma. And I will tell you, I can't say what it is on the air, but if people call me and come in for a consult, I would be happy to tell them. But I can tell you that it is an off-label use of a drug that's being used right now for bladder problems, okay? Including like people who have inflammation of the bladder and that kind of stuff. And as a matter of fact, it's delivered during that time as a flush, so you know it's probably a liquid. So all I can say is come into the office. I will happily discuss it with you because it's very effective in helping the patient. And remember, if there's calcium buildups and that kind of thing, there also is a particular form of chelation we would do. So that's just a side note.
So you've run into this often?
No, pretty rarely, but it was enough to give me the wherewithal to start looking at what else we could do for these patients. And it is something. I found the obscure data that was being done in Italy, Germany, and I think in Austria, where they were using this subclinical dose of this particular thing, IV, and getting good results.
Real quick, we got a couple of minutes left.
Sure.
I want to get back to the skincare line.
You
and Dr. Glass developed.
Yeah.
And I just think it's a great idea for
well,
Mom
it's
for
all
Mother's
natural.
Day.
It's all natural. And we actually have two forms of actually stuff for skin in terms of sunblock and sunscreen.
Yes. And I got a facial several times.
Oh, I know. She's a nice gal.
From your esthetician.
She's very lovely.
And I've got the products. And every morning I see the picture of Dr. Molly.
Yeah, somebody else told me I shower with Dr. Molly, and I did laugh. I said, listen, come on, cut it out. But what I did say is that there's something good about these products. And interestingly enough, there's a gentleman who is our chief maintenance man here in this building, and he says, hey, Doc, I need 2 more of those stem cells, those apple stem cells under my eyes. I said, well, you look darn good, Jimmy. He said, I know, I'm using your product. And I did laugh. He said, I told my nieces and nephews to get me 2 of these for Father's Day.
There you go. See, that works out perfectly.
It did.
It's a complete line of skincare products. Check it out on the web, innovativemedicalassociates.com, innovativemedicalassociates.com. Guess what?
We're at the end of
the show.
Thanks, John.
That's going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by right now, and they'll be there after we leave you at 9 o'clock. They'll be there pretty much all day, 856-489-0505. And, of course, you can call during the week. That's the same number, 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. And don't forget the website again, innovativemedicalassociates.com, innovativemedicalassociates.com. If you missed any of today's show, we have our Health Watch replay this afternoon from 4 until 5 here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, Joanne, fabulous Fran, and our nurses, Jess and Lana, and our medical assistant, Karen Kathy, I'm your host, John DeMasi. Thanks for listening. Have yourself a great week and a healthy one. We'll do it all over again next Sunday, Health Watch, 8 till 9, Talk Radio 1210, WPHT. You take care.
This program is a paid commercial announcement and in no way represents the views of WPHT or its management.